好，歡迎各位傳媒。
Welcome to today's press conference on the COVID situation. With us today, our Permanent Secretary, FHB, Mr. Thomas Chan, and Director of Health, Mr. Ronald Lam, Dr. Chong Shuk Kwan, and also Dr. Larry Lee of the HA. The Permanent Secretary will say a few words, and then Dr. Ronald Lam will brief us on the overall situation. And then Dr. Chong will bring us up to date on the cases, and Dr. Larry Lee will brief us on the hospital authority. Permanent Secretary, please.
Good afternoon. At the media stand-up of the Chief Executive just now, she mentioned that this morning the Chief Executive in Council endorsed a series of amendments to the relevant regulations under the Prevention and Control of Disease Ordinance, and I'm going to give you the details of those amendments. I'll also be giving you information on the vaccine pass arrangement and the further tightening of the social distancing measures. This morning, the Chief Executive in Council amended the Prevention and Control of Disease Requirements and Directions Business and Premises Regulation Cap 599F. So for hair salons, supermarkets, markets, shopping malls and department stores, they are included under the Cap 599F, so they will, so we could impose requirements in relation to vaccine pass. The arrangement will come into effect on the 10th of February. We'll be issuing a direction to that in the light of the severe epidemic. Apart from premises that have to be closed under 599F at the moment, then religious venues, hair salons will also have to close until the 23rd of February. The second amendment is to amend Cap 599G, Prevention and Control of Disease Prohibition on Group Gathering Regulation. The cap will be reduced from 4 persons to 2 persons. We'll also be introducing new gathering ban. We'll ban multiple household gatherings at private premises. That means cross-family gatherings. By multiple households, the definition is that 2 or more households. So if there are gatherings involving 2 households at private premises, that's not regulated. But at the same time, there'll be exemption on carers of any persons in the household. They will not be counted towards a multiple household gathering. That means if there are 2 families gathering at a private premise and there's need for a carer, and that carer belongs to a 3rd household, then there is exemption from the restriction on multiple household gatherings. The third amendment is to actually introduce a new regulation, Cap 599L, in relation to vaccine pass. This is a legal framework for implementing the vaccine pass arrangement. Under 599L, the Secretary for Food and Health may make directions that there is need for vaccination for entry into particular premises. There is also a definition on vaccination. Our current plan is to introduce the vaccine pass on the 24th of February. It will apply to all premises regulated under Cap 599F, including the new premises to be added to the list of scheduled premises under 599F, that is religious venues, hair salons, markets, market fairs, supermarkets, and shopping malls and so on. But then there are premises which are allowed to operate under Cap 599F, that is eating establishments, we will first introduce the vaccine pass for such premises. And this will start from the 10th of February. As for the amendments of CAP 599G, the amendments will come into force on the 10th of February midnight. The directions to be made by the Secretary for Food and Health would also commence on the 10th of February midnight. That means the gathering ban on cross-family gatherings at private premises. Now, with the vaccine pass, for employees of premises covered by the vaccine pass, and also for users going to these premises, they will have to meet the relevant vaccination requirements. For some of these premises, there are already requirements on employees to get vaccinated, and these requirements will remain in force. As for premises not yet covered by such requirements, they will have to meet the vaccination requirement in phases, but there are two exceptions. One, for children under the age of 12. Two, for those who are certified by doctors to be medically unfit for vaccination. Apart from these two groups of people, all users, all customers and employees in relation to premises have to meet the requirement. We'll be doing that in phases. First phase, when we introduce the vaccine pass, the first phase will come into force. The first phase covers all persons aged 12 or above. If they need to enter premises covered by the vaccine pass arrangement, they will have to have received at least one dose of vaccine for meeting the vaccination requirement. The second phase will start at the end of April. So that means 2 months after the introduction of vaccine pass. From the end of April, all persons aged 18 or above must have received at least 2 doses of vaccine. Now, for persons above the age of 18, they are able to receive the second dose in 3 to 4 weeks. So that's why we align 2 months for people to get the second dose. For those aged between 12 and 17, in the second phase, they will have to receive only just 1 dose. Because for those aged between 12 and 17, they have to wait about 12 weeks to receive the next dose of vaccine. The last phase is to start from the end of June. For all those aged 18 or above, if they have received a second dose of vaccine for 9 months or more, then they will have to receive the third dose of vaccine before they could meet the vaccination requirement. And if they have received the second dose within 9 months, they could still meet the vaccination requirement, but before the end of that 9 months, they must take the third dose before they will be deemed to have met the vaccination requirement. For those aged between 12 and 17, if the first dose was taken 6 months ago at the end of June, then they will have to take the second dose too before they consider to have met the vaccination requirement. Say for those taking BioNTech and who are aged between 12 and 17, they are advised to wait 12 months to get the next dose, so there will be enough time for them to receive the second dose. But if the first dose has been taken within 6 months still, then they will still meet the vaccination requirement. Then within that 6 months, they must receive the second dose before they could meet the vaccination requirement. Those aged 12 or under, we've only just started the vaccination program for young children. Therefore, the vaccination pass will not be applicable to them. But then CAP 599L provides a legal framework for us to have regard to the progress of the vaccination program, and then we could review the scope of the vaccine pass. We'll also have regard to the latest recommendation of the scientific committee in deciding on the vaccination requirement under the vaccine pass arrangement. Now, I will give you the implementation details of the vaccine pass. We could, group the vaccine pass into two types. One, the active vaccine pass arrangement that applies to restaurants. Say if a customer goes to a restaurant, he has to scan the Leave Home Safe app. He also has to produce his vaccine pass to the premise management or operator. The government will provide mobile phone app to the operator, and using that app, the operator could scan the vaccine pass information of the customer. The second type is the passive type of vaccine pass. Say someone enters a certain premise, he needs to scan the Leave Home Safe app, but there is no need to produce a vaccine pass to the premise operator. But then there will be authorized law enforcement officers. When required by these officers, they will have to produce their vaccine pass. So this arrangement will apply to premises with large foot traffic. For example, the new premises under Cap 599F for supermarkets, shopping malls, department stores, wet markets, and fairs, because there's heavy foot traffic, so it will not be possible to scan every vaccine pass proactively. That's why we will adopt this passive enforcement measure. For other premises under Cap 599F, when we implement the vaccine pass on the 24th of February, we'll announce the arrangements for these other premises. We've also amended the Prevention and Control of Disease Compulsory Testing for Certain Persons Regulation Cap 599F. We are going to increase the fixed penalty from $5,000 to $10,000. This is to enhance the deterrent effect. So the public will comply with compulsory testing requirements.
Dr. Ronald Lam, friends of the media, let me bring you up to date. Over the past fortnight, we have recorded 2,600 cases of positive infection. Cumulatively, for the untraceable cases, we have 898. 85% of them are of Omicron variant. 5.8% are Delta variant. In terms of community transmissions, if we identify blocks with vertical and horizontal transmissions, the number stands at 33. We are concerned about the homes. If there are cases among the residents of the homes for the elderly, there are 3 so far. We are pretty concerned about this because with Omicron variant, we have sampled about 1,000 cases and look at the CT value. More than 80% of them are less than 30, meaning that the viral load is pretty high, and that the mainstream variant is Omicron these days, and the transmissibility is particularly high. Since the cases are surging, we can see that the public healthcare system is under tremendous pressure. So as of today, we have already started the Safe Home, Stay Home Safe home isolation program for the close contacts and the secondary contacts, and they will be subject to either 4 days or 14 days of home quarantine period. There will be a quarantine order that will be issued to them. Now, for the quarantine center at Penny's Bay, it will be turned into a community isolation facility, and the suitable cases will be progressively moved to this Penny's Bay center. As you're aware, the whole purpose is to alleviate the burden of the public health care facilities, and also would like to buy time in order to free up more space in the healthcare system, and also to encourage people to get vaccinated, not least the senior citizens, those above 80 years of age. We have only about 22% who are vaccinated, so we like to move this vaccination along among the senior citizens. That with regard to the Stay Home Safe home isolation program, as of noon, we have already issued the home quarantine order to 38 people, and we can see that now for the 4 days of quarantine, 19 people, and there's a secondary context, the 14-day quarantine period, and 19. Now for home isolation, there are 3 key elements. The first one is the health management. Now they have to be subject to medical surveillance, and they have to use the RAT, rapid antigen test, on a regular basis to ascertain whether they carry any virus. And they also have to take their temperature. If they feel unwell, they have to make a report to us immediately. Second, we have the technical and technological support. We get the support of the HAD. We do have a hotline designated for these home confinees. During the course of confinement, if they have any particular problems, they can seek help via these hotlines. Third, day-to-day support. We urge the confinees, and we urge the relatives of the confinees to render assistance if there is any need for the day-to-day meals and care. They should deliver the necessities to them. We do have the guidelines that they're not supposed to have any direct contact. The supplies should be put outside the door for collection. And also for the property management sector, we're urging them to offer us support if there are certain supplies that have to be delivered. The property management personnel can offer assistance. The online purchase companies, the couriers, and the delivery companies, they can also offer assistance. And for these sectors, we will issue guidelines and to make sure that in the course of delivery they can do a better job in terms of infection control. We're grateful to the HAB and HAD for organizing a briefing for the property management personnel in terms of the delivery of supplies and assistance to be given to the confinees, like the disposal of refuse and so on. We did offer a very detailed briefing. Finally, I'd like to urge the members of the public to put in the efforts together. It's only through collective efforts that we can triumph over the virus. Epidemiologically, we've seen a lot of infections caused by cross-family gatherings, so please minimize these kind of events, social distance, and get vaccinated. If you, when you're wearing the face mask, it has to be a tight fit, and you have to observe the hand hygiene in your day-to-day life. Make sure that you fill up the floor drains in the toilet in the kitchen with half a liter of water it's important to carry out these measures. The COVID situation is pretty severe. We are facing an unprecedented situation. I think it needs a concerted effort before we can come out of this situation.
Dr. Chuang, now, yesterday, 625 cases tested positive. Most of these are locally infected cases. There are 15 cases during the rapid test and with the L452R strain, that is the Delta strain. The rest are suspected Omicron cases. As Dr. Lam mentioned, many of the cases involved cross-household gatherings. We have done some initial analysis. There are at least 19 big clusters with over 10 persons infected. Some have to do with relatives, meal gatherings, and that's led to transmission in a building block or at the workplace. And in one cluster, we are talking about 47 cases. Altogether, there are 367 persons involved, and we're not even counting the smaller cross-household gatherings of 10 persons or less. And then, as I said yesterday, we have 898 untraceable cases. Most of these cases are in Shamshui Po, Shatin, Kowloon City, Kuaiqing, and so on. As for the residential care homes for the elderly, RCHEs, there are cases that have affected the elderly residents or their carers. And there is a home in the New Territories Tai Chang House. There's a preliminary positive case involving an elderly resident. There are 9 other residents on the same floor, second floor, with this living with this preliminary positive case. They have to be quarantined. And there's another welfare home in Cheung Kwan O. There's also a confirmed case. There are small group activities were held, so 14 residents have to be quarantined. And then Chun Wai Alway Garden, and that's elderly home there. There's also preliminary positive case. We have to check how many close contacts there are. And then Tai Po Lok Sin Tong home. That's also preliminary positive case. 25 persons have to be quarantined. Shang Wan, Po Lang Kok, Lam Kwai Chan home for the elderly, 2 elderly residents, preliminary positive cases. All the residents, all 75 of them have to be quarantined because there's been infection. And then Sham Shui Po Fuji House, there's an RTD exercise. There are rather many units affected. On the second floor, there are 5 units with cases. So other residents on the second floor have to be evacuated. And we've checked the sewage system. We haven't found any major problems with the drains and pipes there. That's all by way of report. Dr. Lee, please. As at this morning, 9 a.m., in the past 24 hours, we reported 364 cases. 83 patients have recovered and been discharged. There are now 13,315 patients who have recovered and been discharged. And there are 1,853 patients now in the North Lantau Hospital, Hong Kong Infection Control Center, HA Infectious Diseases Center, AW Community Treatment Center, and 14 public hospitals. And then there's a case of 14814 in critical condition, a patient age 684, and then case 1340 age 77 also is now in serious condition. Both these patients have not been vaccinated. And then for the case 15118, HN4 and male, he's improved from the serious to stable condition. He's had 2 doses of vaccine. So we can see that we are seeing more critical cases, and our healthcare workers are trying to take care of them. So it's not true that all infected cases are in mild condition. Some actually need oxygen treatment. So that's why I must appeal to those who have not been vaccinated to get the jab as soon as possible. And if you have already taken 2 doses, please do try to get the 3rd dose, especially for the elderly, because that will help to reduce the risk of complications and death. And starting from tomorrow, for children aged 5 to 11, they could make an online appointment for BioNTech vaccination. There are now 3 vaccination centers for children, the Children's Hospital and 2 other places. And starting from the 16th of February, there will be vaccination service for children. Now, for the rapid antigen test, what if you use the kit and then the result is positive? Well, there's a need to do another test to confirm the test result. And the first option for the repeat test is the deep throat saliva test. Now, at MTR stations and other places, you could collect the sample bottles. After you've taken the test, you could ask your family members or friends to help to submit the sample and wait at home for the test result. If you are not able to find any help, then you could go to the accident and emergency ward for the repeat test. But it's important that you do proper infection control. In particular, you have to wear your mask, and you should just take transport to the A&E ward, because actually A&E ward is really busy these days, and the waiting time may be long in some wards, so please be understanding. And then for those with mild conditions, you could consider going to the general outpatient clinic or to a private doctor for treatment that could relieve the pressure on the public system. And then there are also cases of family members being infected. Healthcare workers will try to make arrangements as far as possible for family members to take care of younger children. But then, as we try to, assign wards, we have various conditions. We have to consider the age of the patient and whether there's any chronic condition involved. So sometimes it takes longer time to assign wards, and sometimes it may not be possible for us to put family members in the same ward. And we ask for your understanding if that's the case. And then there's also information of preliminary positive cases involving HA staff. Now, there's a doctor in Tim Mun Hospital and 4 nurses in Yan Chai Hospital, the Robert Black General Outpatient Clinic, and another 2 other clinics, and then 13 patient assistants, clerical staff or outsourced staff at Eastern Hospital, Rattanji, Princess Margaret Hospital, Children's Hospital, Wong Tai Sin Hospital, Haven of Hope Hospital, Tim Mun Hospital, Prince of Wales Hospital, Port Oi Hospital, Tim Mun Hospital. And we have made an isolation arrangement, and then we are doing contact tracing, and also there's thorough disinfection. Now, these staff members wore proper personal protective equipment, so that no other staff members are listed as close contacts, but some of them had meals with other colleagues, so there are over 10 workers, employees listed as close contacts. That's why we have to remind colleagues not to join any social activities. They must not eat together. And then at the Queen Elizabeth Hospital, there are 2 nurses and a clerical staff who are preliminary positive cases. They have had meals with colleagues, so 19 employees have been listed as close contact. For the Queen Elizabeth Hospital, there are 2 ICU wards that have stopped taking new cases yesterday, but then they have resumed normal today. And then there are 6 patients screened with as a preliminary positive cases effectively. That's in Caritas Hospital, Princess Margaret Hospital, and Yan Chai Hospital. And then there are 13 patients in the same wards who are listed as close contact. That's all by way of report.
Let me supplement about the food establishments. Because of the COVID, we have to tighten up the social distancing measures. Now, for the catering premises, for the catering premises that remain open, we require Type D premises, for which the vaccine pass is implemented. The seating capacity will be reduced to 4. That's going into effect on the 10th of February at midnight. And we implement the vaccine pass in these premises. For the other premises that are not fulfilling the requirements of the vaccine pass, we would allow them a grace arrangement. This grace period will be up to 24th of February when they have to implement the vaccine pass. They can remain in business, but the seating capacity per table will be restricted to 2. That's like Type B and Type C premises. And as a result of the vaccine pass, there will only be one type of premises, and that's Type D premises. And they will be subject to a vaccine pass. Thank you very much, Permanent Secretary. I now throw the floor for questions. Please speak into a microphone, and please also identify the organization you work for. Please restrict yourself to 3 questions. Lady in white, please. TVB. Now, at the press conference by the chief executive, she talked about the cross-family gathering. How are you going to enforce the law? Are you going to be knocking on the door of each and every household? Does it mean that it would aggravate the manpower resources on the part of law enforcement agencies? Now, with this kind of patrol, do you think that you need to have a court warrant for you to enforce the law? Later on, it is likely that the vaccine pass will be extended to public transport if the situation is sufficiently serious. Now, how serious does it have to be for this to be implemented? Do you look at the number of positive cases, or would you not look at the positive cases as one of the criteria? Also, the government is encouraging people to go get tested. That the people are queuing up in big crowd to get tested. Are you going to provide the deep throat saliva packs? Are you going to extend the collection period? It is now 9 to 2 or 3. The people have to work night shift. How are you going to make it convenient for them? If you do not extend the hours, what are the difficulties? There are some experts who suggest that we should use the deep throat saliva test in place of the PCR test in order to reduce the waiting time and also reduce the possibility of cross-infection. How are you going to react to this suggestion? Permanent Secretary, thanks very much for your question. The first one is about the multi-household gathering or cross-family gathering. We use households as a unit. It would be hard for us to define family sometimes. Now, for this multiple household gathering restriction, like from the very beginning of our anti-pandemic work, what is important for anything to happen is the cooperation of the members of the public. We're grateful over the past 2 years to the public for their full cooperation. Now, with regard to this new piece of regulation, you've heard the CHP's briefing, and a lot of cases arise from the cross-family gatherings. The idea of introducing this regulation is to let the public know that during this severe COVID period, this kind of cross-family gathering has to cease. In terms of actual arrangement, we're not really enforcing the law proactively. There will not be any door-to-door kind of law enforcement. But if there are any cases that we pick up from our tracing, if we find that people are flouting these multi-household gathering restriction and causing an outbreak of infection, if we pick up these kind of cases and in contravention of this CAP 599, there will be enforcement action taken. I must emphasize, I cannot stress enough that the most important thing is to have the cooperation of the public. Like Dr. Lam said a moment ago, if people can minimize any form of cross-family gathering, it would go a long way towards curbing the virus. We don't really want to see a situation where law enforcement will have to be taken after the outbreak has broken out. Also, the vaccine pass, as I said in my opening remarks, I've already covered the scope of the vaccine pass. We don't have any intention of introducing the vaccine pass to any form of public transport. 599F is a legal, or 599L is a legal framework. This is applicable to any venues or any form of public transport. But as I said at the very beginning, as of 24th of February, when we introduced the vaccine pass, the scope will be restricted to the specified premises under 599F, that is the catering premises and also the specified premises. We would have regard to the COVID situation and the rollout of the vaccination program. And we can see that of late people are more inclined to get inoculated. And we will continue to provide the channel for vaccination and make the necessary arrangement. We hope that in the near future, the vaccine coverage, not least among the vulnerable groups, the chronically ill and also the senior citizens, we hope that the vaccine coverage can be ramped up substantially. And this is something that we're really anxious to see happen. As to the testing for PCR tests, I'm really grateful to the full cooperation of the general public. They are tying in with our CTNs, and they're also getting tested on a voluntary basis. And if they consider the risk level is high, and they're really taking the initiative. I'm also grateful to all the personnel involved. They're working really flat out of late. And we have ramped up the testing capacity over the past couple of days. We have hit a new high, well over 200,000 per day. In terms of demand and in terms of the huge demand for testing, in some cases we may not be able to make it sufficiently satisfactory. And we are causing some inconvenience. We're really regretting that this is happening. We are ramping up the capacity and improving the testing arrangement. If I may spend a little more time about the arrangement. First of all, as the Chief Executive said earlier on, in terms of demand, we have regard to the latest Omicron variant situation. We have reviewed the requirement under the CTNs. Starting from yesterday, the requirement has been changed to twice. For those subject to RTD, there will be an additional 2. There's the first 3 days, and also the 4th, 5th, and 6th day. They have to undergo compulsory testing. This will enable us to manage the testing demand, and this will also allow those subject to the test to have sufficient time to undergo the test. Second, in terms of supply, as the CE mentioned, we are going full steam ahead to boost the testing capacity. Other than the laboratory, we would like to increase the capacity to 100,000 to 200,000 in mid-February, or 300,000 by the end of February. Other than that, we are increasing the testing points. We have 19 CTCs all over Hong Kong, more like one center per district at the present moment. We also have quite a lot of mobile testing centers. We are identifying well over 40 locations where we can set up testing stations on a longer-term basis. We hope that these testing stations would be of a sufficient scale with sufficient capacity to serve the public, and we will have ample room to cater for the crowd. And we will also link up these mobile stations with the booking system of the CTCs, so that members of the public can also make the booking via this system. We also have the same-day booking arrangement, and with this booking system, we hope that we can alleviate the crowd, and we can make it convenient for the public, and they can really make a plan for their own test. Now, for the CTCs and also the mobile stations, there are residents who may not make prior booking, and they just turn up to join the queue. Now, for the mobile testing stations, we have trialed out the ticket distribution system so that they would be able to check their position online to see how far along the queue is moving. And we are introducing or liaising with other contractors with a view to introducing the same to other CTCs and also the mobile stations. And we hope that this will alleviate the crowdedness. I mentioned the 19 CTCs. In addition to these 19, I mentioned an additional 40 large-scale designated centers. So the whole idea is to increase the capacity and make the capacity available to people to use in the neighborhood. And this is to tie in with our principle of early identification and early isolation. That's all I have to say in terms of testing.
Next, please, the gentleman in the green coat. I'm from Now TV. A number of questions about the multi-family gatherings. Now, you say you would not be, checking household from household for enforcement. Now, many premises are closed, so for multi-household gatherings, probably they place at someone's homes. So can people enter someone's homes without a warrant to check if there's a gathering going on? So how exactly are you going to enforce the law? Have you thought it through? And then there are other premises too, like shopping malls. Will there be law enforcement officers patrolling these premises and check if people have been vaccinated? So can you tell us a bit more about the enforcement details? At the media stand-up just now, the chief executive said that there will be amendment to the employment ordinance. If an employee does not get vaccinated, he could be dismissed and is not considered unreasonable dismissal. So does it extend to all sectors, or are you just talking about premises under 959F? Let's say us journalists or bus drivers, they don't have to be vaccinated to go to work. So if we dismiss them, then would that be considered reasonable or unreasonable dismissal? Permanent Secretary, your second question that involves time-limited amendment to the Employment Ordinance that's under the purview of the Labour and Welfare Bureau. I don't have all the details, but my understanding is not just limited to employees of premises under 599F. About multi-household gatherings, as I mentioned, this restriction on gathering of multiple households is meant to send out a message that is with the epidemic raging on, we really should stop cross-family gatherings to cut off the transmission of the disease. Now, under 599G, there are group gathering bans. The Secretary for Food and Health has to make a direction every 2 weeks, having regard to the latest situation. So we have to watch very closely the development of the epidemic, and we'll see if there's a need to keep the restriction on cross-family gatherings. If the epidemic eases, of course, there's room for relaxing the requirement. But for now, we really would like to have the cooperation of the public. They should avoid cross-family gatherings during this period. On law enforcement, let me explain that again. Now, we're not going to take proactive law enforcement actions. But let's say it comes to the knowledge of the authority that there's a violation of the multiple household gathering ban, then we will take law enforcement action under Cap 599G. Let's say in our investigation we find there is any breach of Cap 599G, we would issue the penalty. There's a summons. We've done that in the past. So if there's a need, then we'll follow up on such cases. Sorry, the speaker is not using a microphone. Sorry, the speaker is not using a microphone. Sorry, speaker is not using a microphone. Sorry, the speaker is not using a microphone. Sorry, the speaker is not using a microphone. Now, for cross-family gatherings or for multi-household gathering, there's a definition in the regulation. That means gathering involving more than 2 households. Now, on whether there is need for warrant under the current regulation, there is not any provision for entering private premises. And as I've said, we're not taking a proactive law enforcement approach. So therefore, there is no need to conduct search as you suggested. But say when we need to trace cases and then we find out about multi-household gatherings, then we will take enforcement action. Next, the lady in grey.
Good afternoon. Question from SCMP. So first, what is the definition of private place? How long will the gathering ban start and last? Does it cover taxi, private cars, hotel rooms, and private yachts, and also office? And how will it be enforced? Why search warrant is not needed to enter such private places? And is there any way that the people can file their complaints? And second, is using the latest version of Leave Home Safe app a must? Can people show their paper vaccination record? And third, how many patients have been sent to the Penny's Bay at the moment? And how many local case and untraceable case and preliminary positive case were reported today? Thank you.
Mr. Chen, and then Dr. Lee, and then Dr. Chuang, please.
Thank you for your questions. The definition of private place is specified in the regulation itself, and it is a place which is not readily accessible from time to time to the public. You can see the definition in the regulation. Now, for the I think on the question of enforcement power, let me clarify. I think the regulation itself does not provide any additional power for entry into any private premises. It does prohibit the multi-household gathering from taking place, but it does not in itself provide the power of entry. But I have to say the enforcement power under the other existing legislation still applies. So if in the case, I'm not saying, well, I have already said that it is not an area where we would seek to proactively enforce. But if need be, there are other provisions, other powers in the relevant law enforcement legislation that we may invoke for the purpose of pursuing or investigating or abating any suspected suspected offense that is taking place. On the question about the vaccine pass, yes, for the premises that would be subject to the vaccine pass, the Leave Home Safe would be a requirement. So just like it is now for the premises which are already subject to the Leave Home Safe requirement, that requirement would also apply to the vaccine pass premises. As for the vaccination record, yes, indeed, we would allow both the electronic vaccination record and the paper record to be used for satisfying the vaccine pass requirement. But for the purpose of the scanning, as I've mentioned at the introduction, we would, for instance, for restaurants, we would require the venue operator to scan the vaccine pass of the customers, and that vaccine pass will be in the form of a QR code. So if someone takes a paper vaccination record, it will have to be the paper record with the QR code that the restaurant operator can scan. Thank you.
Dr. Lee.
About the
Okay, so your questions about the Penny Bay. Okay, so Penny Bay, we start the operation today, or maybe I will say more accurate will be this afternoon. We start transferring the patients from the Asia World Expo, the CTF, and also from the HKICC. And actually, we identify around 80 patients that are going to be downloaded, and we're still on the way. So I hope this move can be further release the tensions of the occupancy in the ICC and also the Asia World Expo.
Dr. Chung?
Yeah, at this point, we have around 500 preliminary positive cases. And for the cases reported yesterday, we have around 450 untraceable cases at the moment. For today's figure, maybe I'll report it tomorrow.
好，有冇其他英文問題？
Any further English question? Gentleman here.
Good afternoon, Hong Kong Free Press. I want to ask, because Hong Kong is regarded as one of the most crowded places where people live together, and how will the household quarantine be practical if people are sharing houses, sharing flats and sharing toilets, especially for the low-income family? Secondly, with 80% people infected by Omicron that has CT values below 30, which means a high viral load, would the government consider to release the vaccination records to show that are they vaccinated with the BioNTech vaccine or Sinovac, to show the public the efficacy of different vaccines to provide better choice for the public? Thirdly, you mentioned that relatives and friends should provide aid to people under quarantine in terms of food and resources. Has the government considered how elderly people living on their own will be taken care of, especially after one elderly has died during a lockdown in Tuen Mun? Thank you.
May I invite Dr. Lam to respond to questions on home quarantine?
Thank you very much for your questions. First of all, for those vulnerable groups or those low-income families who are living conditions are not satisfactory, like what you mentioned, need to share toilets or some common areas with other families, then very likely after a thorough assessment, we would move them to quarantine in designated facilities instead of quarantine at home. And on the other hand, if there are other conditions that under our assessment we found that not suitable, such as the individual health conditions with comorbidities, with symptoms, or they are pregnant or unvaccinated and so forth, then we intend to cohort all those with the same risk together under the same unit. So if there's a different risk levels of household members involved, we will separate them to see who are more suitable to be placed under home quarantine, whereas others at the designated facilities. And as I mentioned, if the conditions, health conditions are not suitable, we would also probably move them to designated quarantine facilities so that we have a better management and control over these citizens. And regarding your question of the respective efficacies of the vaccines, currently there are Sinovac as well as BioNTech. So we already have quite abundant data from local studies from the two universities showing that both vaccines are quite effective in producing the T-cell response, which contributed to reduction in severity and possibly reduce the death rate from the T-cell response immunity. So on the other hand, they have differences in neutralizing antibodies. The local studies show that BioNTech got a higher surge in neutralizing antibodies, but we also found neutralizing antibodies in the Sinovac, although there's a difference. And with the real-world data, if you look at other places, such as the Chile and South American continent, where the Sinovac are more commonly used, the real-world data also showed it's quite effective in reducing hospitalizations, reducing deaths. And regarding the provision of logistic or supplies to the families in need who are under quarantine, indeed, we encouraged them to solicit the assistance of relatives and also the property management companies or delivery companies and so forth, so that they can indeed order something that's more catered or tailor-made to their needs. But if those who are living alone or for special circumstances, they require our government assistance, first of all, we provide the hotline managed by the Home Affairs Department. They would help them in whatever ways that they could. On the other hand, thanks to the support of the Social Welfare Department, in very special circumstances, and if they do need help like food supply and so forth from the government, the Social Welfare Department would be ready to provide necessary supplies. And so I think the whole home quarantine to be successful would require not only interdepartmental collaboration, but also the support from the those who are under quarantine at homes. They have to comply with infection control practice and remember not to leave the homes for reasons that are not justifiable. Thanks.
好，下一題後。
Next question, the gentleman at the back, please. AM 730, about the legislative amendments. The multi-household gathering, you mentioned the enforcement. Is it the case that you will not be turning up and enforce the law against individual households? You will be enforcing the law afterwards? For the shopping malls, do people have to show their vaccine record to the personnel on the site. There are some shopping malls, and they're part of the pathway for people to go home. Would there be any flexibility allowed for people to gain entrance? Now, for the home quarantine, you refer to 38 people. How many households, how many units are there? Are there any public rental housing units or private housing? Leung Kit House in Leung King Estate, there are more cases. Are they on the same floor, or where are they? And in the fifth wave, have you seen any pregnant women who got infected? How far along are the pregnancy, and what sort of medication have they been administered? Right, law enforcement, the permanent secretary and the director will deal with the home quarantine, and Dr. Chong will talk about the cases. Right, multiple household gathering and the law enforcement there. As I said, we don't have any intention of law enforcement on a proactive basis. But as I said a moment ago, the regulation doesn't provide the power to gain entrance to the premises. But if there is any suspicion of violation of the regulation, we can use the power conferred upon us. Under the regulation, we are allowed to get hold of certain information. Now, if we have to trace certain cases in the past, it did happen before, and we can go over the CCTV footage to ascertain who went into where. So if we pick up any cases where there is a violation of the multi-household gathering ban, we will certainly enforce the law. In terms of shopping malls, let me say a little bit more here. In the CE's press conference, some questions were directed at the CE also. Under the regulation, we have had regard to the special circumstances when the members of the public are gaining entrance to the shopping malls in order to collect the takeaways or to carry out certain maintenance work, and also to receive vaccination or to receive certain government services or take part in certain statutory procedures. They will be exempted from the requirements of the vaccine pass. Under the law, there is this reasonable excuse that can be advanced if there are certain individuals who have to go past a certain premises like a shopping mall to get to where they live or to get to where they work. Then they can be taken as a reasonable excuse for not observing the vaccine pass. But it doesn't apply to those who are working in these premises themselves. If the premises are subject to the vaccine pass, all the staff members will have to comply with the vaccination requirements. We would have regard to the actual circumstances, and in the enforcement guidelines, we do have a certain flexibility for certain cases.
On Leung Kit House, there are quite a number of units affected, some 60 plus cases involved. They are rather scattered. The relevant authorities and us went to conduct inspection with experts that did not find any problems with the drainage system. That's why no evacuation. There's no evacuation involving vertical or horizontal units. Home quarantine orders. There are 30 persons who have received the orders involving 17 households in 11 different administrative districts. And if I may mention, tonight we will try to announce the list of affected buildings so that you can find out online in which buildings there are persons under home quarantine. I would also like to make two more points. Now we want to give support to those under home quarantine orders. We've prepared an information pack. There's a handbook on 14-day quarantine that includes points to note, infection control measures, helplines, numbers. There's also an electronic thermometer for measuring body temperature. There are also the rapid antigen test kits here. A third point about pregnant women. You know, the epidemic is rather severe now in the community. The Joint Scientific Committee under the Center for Health Protection and the Expert Advisory Panel to the Chief Executive have recommended that pregnant women take the COVID-19 vaccine. The benefits far outweigh the risks, so we'd like to make an appeal to pregnant women to take the vaccine. Last two questions, the lady at the back. I'm from RTHK. About cross-family gatherings, is there a limit on the number of persons involved now for the two households? And you say you're going to take passive checks on vaccination records. What if someone is found to have not taken the vaccine? What would be the consequence? And then for those under home quarantine, would the neighbors know about that, and would there be any means to make sure that the confinees would not leave their homes? Now, under the new regulation, multi-household gathering means gathering involving more than two households. There is no limit on the number of persons involved in the two households. So we're talking about the households, not individuals. So these people have to come from no more than two households. As for the breach of violation of the vaccine pass requirement and the consequence, now whether we talk about proactive or passive enforcement approach, if someone is found to have violated the vaccine pass requirement, for example, that person has not met the vaccination requirement and he enters or is found at a particular premise, there will be a fixed penalty of $5,000. This penalty applies to both workers and customers and other visitors. So whether it's the proactive or the passive enforcement approach, we would like to remind the public that you have to pay attention to premises with the vaccine pass requirement. If they do not meet the requirement and they enter the premises, then they will have to shoulder the legal consequence. That's why in my introduction, I made it a point to explain that we're going to enforce the vaccine pass in phases, starting from the first dose, second dose, and third dose for those aged 18 or above. Because I want to remind the public that if they are to enter any premises covered by the vaccine pass requirement, they have to make sure that they comply with the requirement, having regard to the different phases of implementation. Last question, the lady over there. I'm from the Hong Kong Economic Times. Good afternoon. The number of confirmed cases is 625. Do you have an actual number for the number of local cases? On home quarantine, now you make an appeal for people to give help to the confinees by helping them buy meals, but then people are worried about getting infected. So being too imposing on others. Another question. At the hospital authority, 17 staff members have been infected. Today there are 20 confirmed cases. So does it mean in total there are 37 confirmed cases of staff working at public hospitals? And it seems that there are 30 co-workers already listed as close contacts. So would that affect public hospital service? For a second floor Fu Yut House or Fu Chen Estate in Sham Shui Po, there are 2 confirmed cases. So how many residents have to be evacuated? And then for the Sheng Wan Home for the Elderly, there are 2 elderly residents who are confirmed cases. So are you talking about the same 2 cases mentioned yesterday, or are these 2 other cases? Dr. Lam and Dr. Choi, and then Dr. Lee, to respond to the various questions, please. For home quarantine support, we encourage family members and friends to help out. And for the confinees, they could also do online shopping, or they could seek assistance from their property management. Well, there are all these channels because we want to help as far as possible. If there is enough support from family, of course, that would be good enough. Otherwise, there are other channels to offer help. Most importantly, we have the relevant infection control guidelines. Let's say if relatives and friends have to send the confinee something, they have to follow the guidelines that there must not be face-to-face contact. They could just leave the supplies at the doorstep, and they could then inform the confinee to open the door to collect the supplies after they have left. And then the confinee must wear a mask to open the door, and the mask must be properly worn. And as soon as they have collected the supplies, they should close the door, and then they could wash their hands. So there are guidelines to follow. Is it true that we cannot allow delivery? It's not true. Even say for quarantine hotels, there's a need to deliver meals to those in quarantine hotels, and then family members and friends may also deliver food, and the hotel staff would actually send the meals to the room, but they leave it outside the door, and then after they leave, then they will inform the guests to collect the meals. So that will allow more compassionate approach in offering support to the confinees. And let's say if someone could not get any help at all from family members and friends, and there are NGOs that could offer help. And some asked about the surveillance of confinees. Now, unless it's absolutely necessary, home confinees are not allowed to leave their home. So they have to wear an electronic wristband before they start the home quarantine. So the wristband makes sure that they don't leave the home of the place of confinement. On home quarantine as a whole, we are doing it now. In the past, if someone left their place of confinement and violated the relevant requirement, we have taken out prosecution action in the past.
There are 4 imported cases of all the confirmed cases today. For the Shangwan, Polang Kok, Ngo Kwai Chan home, there are 2 preliminary positive residents, like yesterday. Fu Yut House, on the 2nd floor, 201 to 226, they have to be evacuated. If you take away the 5 confirmed cases, there are 21 households involved. Hospital authority, I mentioned 17 staff members who are positive or preliminary positive, 22 today, or they add up to 39. When staff members are doing their work, and they are fully protected with PPEs, so there are no patients listed as close contacts. There are other colleagues who are close contacts because they did take off the mask during rest, and we do remind colleagues not to do so. During mealtime, there should be a suitable arrangement, and they do experience the difficulties. We are trying very hard to make suitable arrangement there. certainly with less people, the other colleagues will have shared out the law and they will be working harder, but we will make sure that the services will not be affected. That's it for today. Thank you all very much. Sorry, I think I have to explain a little bit more. Workplace, under the law, workplace is a private premises. Under 599G, the group gathering regulation, there is a whole series of exemptions, and they include the gathering needed for work purposes, and there will be exemptions. And in the workplace, even if there is a large number of people in these kind of category, it doesn't fall into the category. Thank you.